Hi, the current state of access of SRHR services and commodities among young people is limited in many parts of Africa. Among the challenges that contribute to that include the lack of information and awareness among the young people, also the lack of favorable legal and policy frameworks. Also, there's this issue of frequent stock out of commodities, religious and sociocultural factors, and also, but most importantly, the inadequate youth-friendly centers in Africa.
Coupling together with other marginal aspects such as gender, age, race, and sexual orientation, persons with disabilities become the most vulnerable population when it comes to accessing the basic human rights, such as access to sexual reproductive health rights. Taking, for example, women. Women with disabilities face the most unmet needs and demands for their sexual and reproductive health rights. They have no access to contraceptives, they fail to get access to self-abortion, even safe spaces when they have been abused. Barriers such as participation barriers, where persons with disabilities are not in the decision-making tables. Barriers such as communication barriers, lack of information to meet all the needs of persons of different forms of disabilities. Accessibility barriers and attitudinal barriers such as the stereotypes and stigmatization do increase the gap between meeting all the needs and the rights of persons with disabilities.
We are seeing a paradigm shift in the conversations on mental health. People are more open to having the conversations. We're seeing government agencies leading the conversations, as well as young advocates and leaders, and conversations on social media about mental health, which has been very important in ensuring that we're creating safe space and having a conversation. Because one thing we know about mental health is it affects a lot of us, and seeing that conversation has been able to promote well-being and wellness in general for everyone. Let's continue talking about mental health. Yes.
The linkage between SRHR and mental health is in, for instance, if a young person contracts HIV or if they have an unwanted pregnancy, one way or another, it's actually going to affect their mental health. And there exists a lot of stigma in the communities, which can be broken by them trying to get rid of the negative social and cultural norms that exist around SRHR and mental health for young people. So my call to government and decision makers would be for them to increase investment and funding towards SRHR and mental health for young people, as well as creating an enabling environment, an enabling legal environment.